What's up, beautiful people? Another day, another study. It's really important when you look at neurocognitive diseases, things like Alzheimer's and Parkinson's, that we adequately risk stratify people because these things take a long time to develop. So knowing when you are at risk and being able to do something about it is extraordinarily important. And we've seen some associations with things in gut health, things like dysphagia, things like constipation. Chronically, people who have these things are at higher risk for developing Parkinson's disease. Well, the authors of this study thought maybe there's an association with mucosal damage, so damage to the esophagus, things like peptic ulcers or erosions, and Parkinson's disease. And they looked at data from EGDs where we take a look at the esophagus and stomach with a camera, and they looked at the association with development of Parkinson's disease. And they found that patients who had mucosal damage were 76% more likely to develop Parkinson's disease. They also found that patients who had mucosal damage in things like acid reflux and H. pylori, an infection of the gastric mucosa, were much more likely to develop Parkinson's disease. And they found that after the diagnosis of mucosal damage to the development of Parkinson's disease was an average of 14.2 years. So this is something that we need to do more research on, to look at these associations, find out the mechanisms, but I'm all for doing more research on associations so we can prevent these diseases.